Thank you, gentlemen. Thank you. What a wonderful app. So earlier today, you heard from HHS Deputy Secretary Scott Gould and John Bon Jovi. Still kind of blows my mind to say that out loud. Talk about the Project Reach Mobile App Challenge. Now we'll have 4 of the finalists from that challenge effort presenting today. So I'm very proud to introduce from Binary Group, Robert Damashek, who is the Chief Architect of Binary Group, Inc., who will be talking about homeless connections. Thank you, Robert.
Well, thanks for the opportunity to be here and share a little bit about what to us is an issue close to the heart. We've worked for many years with both veterans and military, and they come from a family, and then they get thrown into a situation and a bureaucracy that is not as forgiving, it is not as family-like. So for us, this has been a bit of a passion in taking the challenge at heart and trying to make something really simple and accessible for homeless veterans. So in our app, you'll see from the very beginning, we are trying to take the items that were most important, most critical to a veteran on a timely, immediate basis, like food, shelter, health care, jobs, and make that accessible in a simple environment in a click. This will run on pretty much anything. It will run on the iPad, if I can ever bring it up, yeah, an iPad or an iPhone. And since I have to unlock that thing, I'll put it on my little BlackBerry, the lowliest of lowliest smartphone, so that many people in government work with. So the idea was make the information as accessible as possible. Fortunately, we found an environment that made it possible to do that. This is a web-based application, and the way it's organized, it's a 1 or 2 click kind of step to get pretty much anywhere if you're looking for food. And if you don't know, the Project Reach challenge was organized around trying to find information that's local to a certain place in New Jersey, which is where John Bon Jovi's food kitchen, Soul Kitchen, is. So all of this information is localized to New Jersey, but we've designed the app so that it will work in any kind of area. It's just that the target right now is to New Jersey. So with 1 click, you can find, in this case, a food pantry. You can click on it, and you get the standard kinds of things you get in an application, and it will map it on a page. If you have it on a phone and there's a phone number, you can click on that, and it will dial it. So for shelter, you get the status in real time, and this was one critical thing to a homeless person. Where's there a facility that has beds available for me? And so we're pulling that off in real time and showing that information. And the way that the shelters like to work with it, they'll point you to a point of service contact and call them, and then you'll create your find out that for sure you can get into that shelter. Healthcare facilities, similarly organized simply by tabs. These are all local healthcare services. There are some that are nationwide, but we've organized that separately. And then if you go back, if I get there, the jobs, we have the ability to bring up, we're using 4 or 5 sites in the initial app that we're addressing. And this is an area that we hope to expand upon as we get ready for the beta test trial. But you can type in like a location, and it will tailor it, and you'll get a list of only the jobs in that area. These are the most recent jobs. You can sort them by name. You can put in a job title. Let's say there's something to do with computers, and it'll come back that way. So again, we want to make it as simple and accessible to to really the caseworkers for homeless vets. Excuse me a second. Back and go. And then legal. In most cases, these are people that offer specific legal services. In many cases, with homeless people, they'll get in trouble with the law and they'll need legal services. So part of the whole case perspective, get legal services. And then we have a whole slew of other services that are largely information-based, where the veteran and their caseworker can research things about support for disabled people, employment support services, things that the VA may offer in terms of benefits, where it's not a local immediate kind of service that they need, but they are information to help them walk them through the process of getting at the service that they want. And then finally, in this initial version, we've added a feedback form where people can respond. People who are looking at the app can find areas that they would like services that we haven't thought about yet. And then we're just capturing a little bit of information that then they can send back to us, and we'll respond to it. So it's really a basic package of both immediate and then informational, longer-term research kinds of services. Now, what we hope to do in the future is add some perspective of knowledge about the veteran themselves, realizing that this is a mediated kind of thing. There's a caseworker typically involved in this process, but there's no context for the veteran. First of all, they don't have a home. They don't have a place they can receive things. So we're trying to create, in our vision, a little bit more of a home away from home, or a virtual home, which will have more information about the veteran. And then when you're searching for services, you'll be able to reuse that and not have to enter it every time, not have to learn about the patient every time. In the field, this is called case management, and you have some sense of the context of the veteran. The VA talks about veteran-centric care, and I think case management and the ability to pull that knowledge together is like a fundamental element of being veteran-centric. And then in the other areas, I mentioned a little bit about jobs, about these other kinds of services. How could we tailor it to the specific skills, experience, abilities of a veteran? How can we connect veterans with people who might be there for them on a longer-term basis? I was talking to a family member who's a public health nurse, and she mentioned this issue that many of the patients she deals with who are homeless have mental health issues, but a number of them have goals they're trying to achieve, and if they don't have somebody there with them on an ongoing basis, helping them push to the next step, keeping them aware of what's available, how do they move forward to the next step. That's part of the kinds of things we're going to try to enable. And then it's an area where there might be a way, because our application is called Homeless Connections, where people who have some time on their hands, who might have been veterans or can understand and can just basically be there as a listening voice, not in an official caseworker capacity, but maybe in a support capacity. So those kinds of connections are things that we're looking forward to for the future, bring to the table as we go through this beta test and help set the stage for hopefully what becomes a service for the homeless in general. So that's all I have. I'm glad to take any questions you might have about the app or about what got us going. I think we're pretty open. Yes, is there a mic or something?
There is.
Okay, great, thank you.
I think I didn't catch it. Just repeat.
Deborah Rios. Can you hear me at all?
Okay. Yeah, thank you.
Okay. My question is, you mentioned caseworkers. So from that, I'm assuming that this would be veterans that are enrolled in the healthcare system. My question is, there are some veterans that are not enrolled and may not be eligible for care due to their discharge and whatever details. Those vets, I believe, can get help through vet centers. Would this possibly, there be a way to get this application through vet centers, not just caseworkers?
Certainly, that's something that we're not going to be tied to any specific, to like the VA's system in a way. And you know, there's this whole area of personal health records, which is becoming bigger and has a certain momentum around it. In reality, it's the veteran themselves. It's a person that needs to take charge of their lives, and if we can help them do that through whatever mediation, whether it's a vet center or it's other, it can be a community kind of service that's offered through you know, church or some other organization. Our goal is as long as the veteran has basically said, "Can go ahead, help me," they're making that decision. We'll you know, allow people to utilize the system.
Is there some online access yet?
It is accessible at the URL that I have on here. That's if you go to the Project Reach Challenge site. We're in the gallery, and there's a link to our page. So it is accessible. Just to realize that it's, because of the contest, it's tailored to this locale in New Jersey, right? So it's not accessible nationwide, but that's part of the future goals of where we go. But we're welcome to feedback and from care providers from whatever perspective you have and input on how to make it better. Thank you. Any other questions?
Hello. Hello. Hi. Hey there.
Hi.
Question, how do you keep the information current, especially that pertaining to the availability of beds and food and some of the clothing that I saw in one of the links? Thanks.
Right. It's a very good question. Certain of the information is managed and it's already provided by the community in a semi-real-time kind of way. It turns out that the bed information is something that either on a regional basis or county basis that has to be provided in order for the shelter to get its funding from HUD and others. So we're just tapping into that data. Now, some of the data, the jobs, for example, that's real time. The job services folks are in business to do that. But as we evolve it, you know, we're going to be being more proactive in the way that we pull it from the web. Right now, to get through the challenge and get in the queue, we had to, you know, there's some more that was static than what we intend in the next phase of it. Another question?
It's more comment than a question. I'm an emergency physician. I've treated my share of veterans in the emergency department, and they need substance abuse services as well. So I don't know if that falls under other services and under your mental health, but I would recommend making a specific tab for substance abuse services. Put your AA, NA information there, as well as all the local substance abuse services.
Thank you very much. If there's nothing else,
Okay, great, Robert.
thank you.
Very much.
Thank you.
Appreciate it. Terrific. Thank you. Thank you.